an infectious disease happens in one of Nigeria's neighboring countries, it will only take 36 hours for it to hit us here. One good example is the Ebola epidemic. Is Nigeria ready for the next disease outbreak? According to preventepidemics.org, Nigeria is not. What do you think? We went out on the street and this is what we found out.
It was disastrous. A lot of lives are wasted.
They said everybody should take salt.
Yeah, the whole no eating of bushmeat and every other thing.
So a lot of people were stigmatized. Like checking your temperature, washing your hands. At that period, we asked not to hug.
There were awareness. Those affected, the victims were quarantined.
The response was good and prompt. At least they limited the casualties to basically legal.
Sensitization, there should be more funding, to the Office of National Disease Control Center.
If there are centers provided where people can hear about what Ebola is, how to avoid it, cases where they see the symptoms and the signs and what to do next, centers put in different local government areas, people would actually respond towards that move by the government.
The heightened level of alertness was there, but still you'd still want to demand for more.
I don't think we're ready because we are never proactive. We always wait for it to come and hit us before we take action.
For me, I would say no.
When you talk about being ready, I don't think Nigerians are always ready for most outbreak.
Yeah, we said they are ready. They are ready, at least from the way they handled the Ebola system shows that they are ready to handle any other.
One thing that is definite for readiness is monetary value. There must be the money to fund these things. Do we have the money? I believe so. Are we putting the money towards getting ready? I doubt.
Let's make a media point at this local government where anything happening in the environment, they can easily communicate to the public sector, like health sectors, that, okay, this is something we'll find here that we've not seen before. Do you understand?
Government should not play politics when it comes to health. When it comes to health, it should be taken strategically and it should be deemed paramount.
They just need to fund the sector very well.
Whatever it is we did in the past that helped us tackle it, we should just continue to be a lifestyle. It's not something we'll do today because we've taken care of the situation, we back off. No, we should continue doing it and we'll find out that we'll all be fine.
There you have it. For Nigeria to be ready for a disease outbreak, our Public Health Institute, the Nigeria Center for Disease Control, must have the financial backing it needs to implement an effective epidemics preparedness plan. Do you want to learn more about how you can advocate for and improve funding for epidemic preparedness? Join the conversation on Twitter using the hashtag #PreventEpidemicsNiger.